Hello, everyone, again. I'm delighted to introduce Dr. Richard Siow from King's College in London. Dr. Siow is Director of the Ageing Research Centre at King's, and he will talk to you now about Longevity AI Consortium at the college. Thank you, Richard, and over to you.
Okay, thank you very much, Julie. Can you hear me? Hopefully you can all hear me because I can't hear you, and I assume you can. And secondly, I'm going to switch off my camera because it may be distracting for you to focus on the slides, which should be on the screen. So I hope you can all see it, and I will come back with my camera at the end in case there are any questions. Okay, so thank you very much to Julie and also Helen from the Department of International Trade for this kind invitation for myself to highlight what we have been developing at King's College London as part of our Aging Research at King's initiative. And this initiative has been developed for over 5 years now, supported by charity, government, and also industry funding. And most recently, we have established the Longevity AI Consortium at King's, which is part of our broader AI Centre for Value-Based Healthcare. And this initiative really brings together academia and industry to build an AI for Longevity innovation hub. So Julie nicely introduced aging research in the UK ecosystem in the previous talk, and I will focus on what we are doing at King's and also some of our global partners. As you can see in this slide, we do have a number of industry and charity and also policy partners, which I will elaborate on. So to start, let me see if I can advance my slide. Right, so we are based at St. Thomas's Hospital. For those of you who do not know, we are right in the centre of London, opposite the Houses of Parliament, which perhaps you can see my mouse on the screen. So we're central to London and also where policy decisions are made. And this is Westminster Bridge and the River Thames. So the AI Centre for Value-Based Healthcare is actually within St. Thomas's Hospital with the clinical and also academic excellence and expertise. We are part of King's College London that has been awarded initially £10 million last year to develop the AI Centre, and recently an additional 16 million from the Office of Life Sciences. This has enabled the AI Centre to expand to 4 universities in central London, 11 NHS trusts, numerous industry and SME partners, and of course the Health Innovation Network, with access to 25 million patients in London and the South East. So this is a large initiative of which the Longevity AI Consortium is part of, together with Aging Research at King's. And at the beginning, this has really involved the King's College London School of Biomedical Engineering and Imaging Sciences in the use of AI technologies for better computational modeling and also image analysis, MRI, CT, and so on. And also machine learning and image analysis has been core to the activities of the AI Centre. However, longevity and aging doesn't only occur in the clinic and in the healthcare system, it is much more in the community at the consumer level. And this is something that we are developing with our technology partners to really better understand aging and healthy longevity in the community, how we can delay the onset of age-related diseases and also develop biomarkers for personalized aging, healthy aging and longevity. It is not one size fits all, as we now know. And the resilience towards age-related decline really does require better AI and also machine learning technologies coupled with the scientific academic research with our industry partners. So the AI Centre has a number of high-profile global partners including NVIDIA, GSK, IBM, as well as our academic and healthcare partners. One of our core partners, NVIDIA, that many of you will know, are really interested in how to develop the community healthcare, what this means to the health of the consumer, as well as the clinical setting and medical imaging. So we are also part of a wider UK network of data centers that are also involved in health and longevity research. And Julie had mentioned the National Institute of Aging in Newcastle and other partners associated not only with aging research, but development of AI technologies for better healthcare, value-based healthcare. And this reduces the healthcare burden of society. And this is coming back to our interest also in better informing policymakers. So the AI-enabled hospital infrastructure, many of you will know that this is rapidly developing. Even over the past 5 or 6 months, we have advanced in technologies and awareness of the importance of AI in healthcare delivery and also prevention. So together with our NHS partners across London, we are developing both the AI hospital infrastructure, data governance, and so on, but also at the consumer and community level. And that is most important so that we can maintain the population in a healthy living state, not in the clinical care. So AI informatics and infrastructure is core to our activities in developing better algorithms and better data governance as well across many different sectors, from the NHS through to the consumer market. So I won't spend time to go through these slides, but as you all know, data governance, better, robust data collection, and also analysis are crucial as we develop AI for longevity, especially as we need to define what is health. It's much more difficult than defining disease. So it's not one size fits all, and aging starts on day one of life of your parents all the way through to the end of life and perhaps beyond. So it's not as simple as the clinical hospital setting where AI was originally developed for healthcare. So the Longevity AI Consortium was established as a leading academic industry R&D hub. Many of you in the audience are in the industry sector, and what we are hoping to develop is a way in which you can better interact with robust academic research and to develop your products for the community. So we have developed computing platforms for minimum viable and comprehensive panels of biomarkers of aging. And again, it's not one size fits all. Different communities, different nationalities, ethnic groups, genetic variability. All of this is data collection. Very important that we use the right AI technologies to better understand this and to implement aging research as a framework for better informing government policy as well. And we have seen this very recently in the pandemic, where the government is in constant dialogue with both academics and also industry partners to better develop the therapeutics necessary and also the resilience against age-related decline. So just to reiterate, we do need cross-sector synergy, academia, industry, but also the financial sector. There are some of you who are investors out there. What does the financial longevity sector consider as important in developing new therapeutics, new technologies? And I think this is an area to develop for the future. Financial longevity can impact on physical health and also mental health. How we can better integrate the fintech sector with health tech and age tech, for example. Again, just to emphasize the importance of integrating age tech, academic research for the biomarkers of aging, financial wellness, precision health, all are crucial to better understand longevity and to implement AI technologies. So major R&D focus and goals of the Longevity AI Consortium at King's are to really accelerate the diagnosis of age-related health decline, how we can reduce the incidence of age-related diseases and enhance healthy longevity. For example, this could be through modulation of sleep, nutrition, physical activity, and environmental exposure, pollution, and so on. And this is very important for better informing policymakers so that we can extend wellness across the different communities, different population demographics, the young, the middle-aged, those at work, and also those in the care home later on in life. So it's very important that we integrate data from across all of these sectors. So our consortium will rely on both academic R&D and also industry engagement. And this is to drive a paradigm shift from treatment to prevention and to better understand resilience against age-related conditions. And this is from precision medicine all the way through to precision health. It's not only personalized therapeutics in the clinical setting, but health and longevity in the consumer setting, in the supermarkets. That's why we've engaged with consumer goods companies who are very interested in this area, as well as insurance companies for healthy longevity. So this lends itself to the commercialization and also clinical implementation of the technologies that we are developing. So we are hoping to bridge academic research with practical implementation with our industry partners as well, spinning out our technologies, but also spinning in companies into our academic setting to accelerate their R&D pipeline. So we will provide the academic background and also mentorship and partnership opportunities with our global network. So as we focus in London, we have many partners globally who are also doing similar research, and that's why we need to have both the academic and also corporate partners, as well as our NHS and clinical partners. So this is an important way forwards over the next decade that we do work together, and we seek the investors and the funding bodies from the government and charity sector to really invest in this new approach. These are just examples of some of our charity industry partners. Longevity UK in the middle is our policy partner. They are the Secretariat for the All-Party Parliamentary Group for Longevity, and that has been very important to better inform parliamentarians. I'm going to skip over some slides because of time. These slides will be available online eventually. But what we hope to do is to use data science and AI applications for biomarker discovery. And this is from preventative medicine all the way through to personalized longevity in the community, as I have already mentioned. This is a paradigm shift from treatment and sick care to preventative medicine and healthy longevity. We really do need a better understanding of biomarkers and how we can implement therapeutic strategies. So to use AI in longevity is so crucial over the next decade, and this is what we are hoping to develop together with our industry partners. So biomarker panels, this has been accelerated through the pandemic. The past 6 months have really been almost 5 to 6 years of advancement in many of these areas. So the priority areas of our consortium are to develop AI technologies, but also to better educate the community. That's the policymakers, the academics, and also industry and investors in the importance of longevity and AI. So again, I will skip over some slides because of time. And just to come to the end of my talk, it's really about AI-driven precision diagnostics of biomarkers all the way through to AI-driven implementation of preventative therapeutics. So some examples of what we're doing from the basic sciences, stem cells and medicine. I'm going to, again, slip through a lot of these slides because of time. I'm afraid we don't have time to go through all of the examples, but I'm happy to answer questions personally afterwards. From cell biology all the way through to cognitive health, cognitive decline, mental health, key areas that we are developing with numerous partners. As I mentioned, our engagement with industry, SMEs, is really to accelerate this area of research. And this is another aspect that we are now developing, an accelerator program that is focused on AI for the longevity industry. And I believe we are first in the sector for that. I'm just going to talk through very quickly some examples of SMEs that we're already working with. Altaflora for natural therapeutics, Elosia for a digitized platform for measurement of human samples from saliva and blood and urine. And that's run through Siow Health, our partner. Also AI-led ecosystems for investors as well. Another partner of ours is Stein, that we are working with to develop software and data R&D. And just to finish, not so long ago, in February 2020, we had the Health Secretary, Matt Hancock, many of you know, coming to launch the All-Party Parliamentary Group for Longevity National Strategy for Longevity. And this is so important, and he has endorsed our redevelopment of the national strategy in light of the pandemic. Back in February, we had no idea we would be in this position just 6 to 7 months later. Our international partners, including the University of Zurich, I know many of you are Swiss-based, but globally, we have many partners who are developing the longevity AI concept with us. And this is so important, again, with the global pandemic, that we utilize the expertise of academics and also industry. Now, I have to give thanks to our major corporate sponsor, which is Unilever, a consumer goods company, along with our charity partners such as the British Heart Foundation, Alzheimer's Research UK. So thank you very much for listening, and I'm sorry for running over time slightly.